It's Dr. Robert Strang, Chief Medical Officer of Health. Today we're announcing 20 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 147. Most cases continue to have connections to travel or a known case. In fact, when I looked at the data this morning, we had 96% of our cases fit into one of those two categories. However, as we reported yesterday, we now have one case that has no links to travel or a previously known case. So we have to conclude that it's the result of transmission within a Nova Scotia community. We have a small number of other cases that are still under investigation that is not clear yet where the individual may have been exposed. To date, 4 staff and 2 residents of the long-term care facilities have now tested positive for COVID-19. Appropriate infection prevention control measures and measures to support staffing are in place for both the residents and staff in these 3 facilities. To date, Nova Scotia has tested 5,763 people who are with negative results, and another 147, as I said earlier, who are confirmed as positive. Again, as I say almost every day, or every day, it is now, it's so important that Nova Scotians continue to stick with the following public health orders and directives. Practice good hygiene. Maintain a physical distance of 2 meters or 6 feet from others when you're out of the home. Only stay home as much as possible. Only leave the home for essential shopping, and if people are going shopping, it should only be one person from the house. If you're just on social distancing, like most Nova Scotians, you can exercise in your local community. As the Premier says, walk to exercise, not to socialize. People should not get together in groups of more than or 5 people or more than 5 people. It's important people understand that and even getting together with that small numbers only if necessary and essential. This is not a time to just casually socialize, and just because it's nice to get together with people. You should only get together, even in small groups, if it's necessary. I understand the challenges around that, but we're asking Nova Scotians to work together to keep each other safe. The stronger we are together in applying these measures now, we'll keep each other safer. We'll actually also put us in a position where we can start to loosen off these restrictive measures as soon as possible. I want to talk to Nova Scotians about protecting themselves from false claims for cures or things that boost their immune system. People are fearful and vulnerable at this time when there's a lot of uncertainty, and unfortunately that unscrupulous people are making claims about various health products or various health related kind of procedures, which I've seen them say you could boost your immune system by 200%, or I have a product that's can cure COVID-19. These are all false. They're giving people false hope for potentially spending their money unnecessarily. These do not work against COVID-19. We know that there's ways to boost your immune system are well known, but they're simple. It's about getting good sleep as much as you can, eating a healthy diet, getting some regular exercise, socializing with each other, virtually these days, but all those things actually help keep you healthy and boost your immune system. You don't need extra products to do that. There's active research going on to identify direct treatments for COVID-19. Nova Scotian researchers are part of that, but to date there has not been identified any pharmaceutical product that is for sure going to be effective in treating COVID-19, and we don't have a vaccine at this point. So any claims if you're seeing claims that are out there that actually say we can cure COVID-19, those claims are false and they're wrong. Don't believe them, please. The other thing that people are hearing that come to my attention is that people are getting contacted about claims about whether it's gloves or masks, things that people can buy to help protect themselves, often at inflated prices. First of all, just the general public wearing gloves or masks has not been shown to help prevent the spread of this disease. But also many of these products, we have no idea how well they're made. Are they appropriate? Are they going to be effective or even safe? So please don't fall for those scams either. I want to end up by talking about, I've talked in the last few days about we've rapidly expanded our testing ability. We've rapidly expanded the capacity in labs. Today I want to focus on my colleagues in public health who follow up each and every one of those cases, whether they're positive or negative. They're working extremely hard. I want to thank them for the work they're doing and let Nova Scotians know that when you're tested for COVID-19, whether you're positive or negative, you are going to hear back from somebody because you may have questions or concerns. It's important that you have a chance to have a conversation with somebody and get the right information and ability to ask questions so you can understand that information. We have a bit of a backlog. It may take 48 to 72 hours to hear back. I appreciate that may be a bit of a concerning time, but with the volume of testing, it is taking a bit of time to get back to people. But please be reassured that once you're tested, you will hear back and you will have an opportunity to talk directly to somebody who can answer your questions. I ask for your patience, and again, I thank my public health colleagues who are doing this important part of the COVID-19 response.